So I checked the orders and I find that Mrs. Katz's doctor has ordered an indwelling catheter for her. So I gather my equipment, get my Foley kit, and a waterproof pad, a basin of warm soapy water and some washcloths. I enter the patient's room, pull the curtain for privacy, wash my hands. Good afternoon, Mrs. Katz. My name is Craig. I'm a student nurse. Your doctor has ordered an indwelling catheter for you today. What that means is that I'm going to be inserting the catheter through your urethra, and it will go into your bladder, and it should help you void your bladder completely and get rid of any kind of urinary retention you're having. So, is that okay?
Yes.
Okay, so let me check your armband first. Can you state your first and last name and date of birth for me?
Kitty Katz, March 1st, 1960.
Excellent. Okay, and your chart indicates that you don't have any allergies, but I have to double check before we proceed. Do you have any allergies to betadine, iodine, or to latex?
No.
Okay, excellent. All right, before we proceed, I will have to inspect the area first and cleanse it, which means I'm going to be uncovering you and I'm going to be touching you. Is that okay?
Yes.
Okay. So, at this point, I would raise the bed to a working height, and I would position any light source that I needed for the inspection, or have somebody hold the light, but the lighting in here is adequate for what we're doing. So, next, start putting on my gloves. Okay, Mrs. Katz, I also need to ask you today if I need you to help me out by like raising your hips once or twice. Could you be able to do that for me?
Sure.
Okay. Awesome. Okay, I'm going to be uncovering you now, okay?
Okay.
All right. Okay. You go ahead and lift your hips for me.
Okay.
And so place the waterproof pad. Okay, thank you. You can put your hips down now. Okay, if this were a male patient, I would cleanse from the urinary meatus down to the base of the glands 3 times using a different section of the washcloth each time. If it were uncircumcised, I would retract the foreskin to do that. Okay, Mrs. Katz, I'm going to be touching you. Is that okay?
Yes.
Okay, so I would separate the labia just a little bit, clean the outside side first, and then the outer side on the closest to me next, and then we would go once down the middle, and once down the middle. Okay. Remove my gloves. Wash my hands again. Okay, Mrs. Katz, we're going to go ahead and proceed with the catheterization now. Let's get this positioned here. Okay, I'm going to go ahead and square off. All right. Next, we get the waterproof drape. Okay. Okay, Mrs. Katz, can you lift your hips up for me one more time?
Yes.
Okay. All right, position just right. Okay. And then since there's not enough room on the bedside table, I'm going to do the still loving at the foot of the bed. Make sure not to touch anything in here other than the package. I'm not leaving that out on my side either. Okay. More touching on the inside. Okay. Okay. Now, come over to the cath kit. I'm going to make make sure we stay inside the sterile field as we proceed. All right. Okay, so we're going to put the solution on the cotton balls. Okay. Then we're going to go ahead and put the lubricant in the tray. Okay. Now, over on this side, I note that the clamp on the catheter bag is closed. Okay. Go ahead and take the catheter over here, lubricate to 1 to 2 inches, and place it back over here. Then we're going to take our sterile water, uncap it, all right, and we're going to move closer to the patient. All right, okay, now, if this were a male patient, I would be taking each of these cotton balls, and like we cleansed before, I would be cleansing from the urinary meatus down to the base of the glands 3 times, leaving the foreskin retracted. However, it's Mrs. Katz, so I'm going to come down here and I'm going to separate the labia again, and I'm going to take cotton ball and go down the far side. And then near side. Down the middle. Down the middle. We're going to get rid of the top tray. Okay. Next, I'm going to take the catheter. Okay, Mrs. Katz, this is going to be a little uncomfortable. I want you to take a couple of deep breaths for me, okay? Okay, now bear down for me, okay? So I insert the catheter. I note that urine is coming out now, so I insert it 2 to 3 inches further. Okay. Then I grasp it with those fingers. Come over here to inflate the balloon. Okay, now I'm going to gently tug. Feel resistance. There's resistance. So I'm going to take this hand now, remove the syringe. At this point, I'm going to go ahead and remove the bag. Get rid of this. All right, what I would do at this point is I would attach the part of the catheter to the patient's thigh with tape or something. Make sure the bag is below the bladder. I would probably hook it onto the bed, and I would note the color, the clarity, and the amount of urine. So we'll say it's clear yellow, 300 milliliters, and that would be that part of it. I would also, at this point, I could be safe getting rid of the drape. Then I would cleanse again. Okay, and if we're a male patient, once again, cleaning around where the meatus is, to the base of the glands, and if there's any iodine or anything else is run down the shaft or anything, I would clean that as well. And at this point, I would replace the foreskin. With Mrs. Katz, I would clean the same areas again. Around the labia, if it was on the thighs, I would clean the thighs. If it ran down to the buttocks for any reason, there as well. And I would just make sure she was cleaned up and comfortable. And then I would cover her back up. Lower the bed to a comfortable position. And ask her, where she'd be more comfortable sitting up, lying down. Okay, Mrs. Katz, do you feel comfortable now?
Yes.
Okay, I'm going to leave your stuff here on the bedside table. It's within your reach. I'm also going to leave the call button within your reach. So in case you need anything, you go ahead and let us know. I would remove my gloves, wash my hands once again. Okay. And then I would document the procedure and her tolerance for it.